Fortunately, weapons of mass destruction and terrorist acts are not a terribly common event, but it is something we definitely have to be prepared for, and these can be relatively small explosions or events to something very, very massive. So we do need to be prepared for these. Always need to be thinking about safety with these. Sometimes the terrorists will put a secondary device in that will then explode after we arrive on scene and will affect us. So we need to be very cautious and very aware of what is happening around us. There also is a possibility that some chemical agents were involved, making it a hazmat scene or radiation. So you have to worry about that, or even sometimes biological agents. Things can be released into the air that we can then get. So you always have to be thinking about safety with these. We have two acronyms that we use to remember what the categories are of WMDs. CBURN, which is chemical, biological, radiological, nuclear, or explosive, and B-NICE, which is biological, nuclear, incendiary, chemical, and explosive. One of the more common ones is explosives. So they create some sort of a bomb, improvised explosive device, or something larger that then goes off. And think back to our mechanism of injury chapter. With these, we have four primary events that occur. You have the primary blast wave, which will cause damage to the eardrums and the lungs and the intestines. And depending on how big that is, you may have damage to all three of them. They say that if you know the blast wave is coming, to lay down on the ground, put your feet towards the explosion and head away from it, and it'll minimize the effects of the blast wave. Don't know if we're going to have much of a chance to do that, but it is something you can try to do. It also would minimize shrapnel, and that is the secondary effect of explosions, is all the flying debris. The third or tertiary is when you get knocked down, thrown against something, or something may land on you. And then quaternary is whatever else might be in the air. And if this was something like a terrorist that had a bomb packed around them, it could be all of those particles left from that explosion. So thinking about that. Now, as far as treating the patient, it depends on their injuries. So be prepared for them not to be able to hear real well because their eardrums are going to be damaged. They may have lung damage from the explosion and their alveoli being popped, so pneumothorax is a possibility. Generally give them oxygen. Now, if they have some burns or something, we need to treat that like you would burns. And then any shrapnel wounds, you would want to treat just as you would any other soft tissue injury, with controlling bleeding and possibly tourniquets. Incendiary devices, these are ones that are primarily designed to burn. And a lot of times you think napalm when you hear these, but white phosphorus also will do it, magnesium can do it. And big thing here is to stop the burning process. So again, thinking safety, get them away from whatever's burning them, try to cool them off if at all possible. Now, some of these chemicals will react with water, so they might actually become a little bit worse before they become better. So make sure you have enough water to cool them off. Large amounts of water. And then treat the burns like you would any other burn with dry burn dressings and take them to a burn center. Chemical agents are a little tricky. Some of these make it a hazmat scene, so look for multiple patients with similar signs and symptoms and think hazmat, and get people there with the personal protective equipment that can deal with whatever the chemical is. These could be things like nerve agents. And nerve agents, think sludges with the salivation, lacrimation, urination, defecation, GI, emesis, and even some muscle tremors and things like that. If you could expose to these, this is what your Mark 1 kit is for, or whatever your antidote kit is. But if you have patients that are exposed to these, we're going to have to decontaminate them, so wash them off, rinse them off, following proper decon. And they may need ALS care as far as they will need a medication called atropine. And that's part of your antidote kit, but it's not going to be used on the patient. Remember, your antidote kits are just for you, not to be used on the patient. Vesicants are chemicals that are going to irritate the skin and cause a lot of burning, blistering pain. Again, decontamination is going to be the primary thing. If they happen to inhale some of these vesicants into their lungs, they're going to have some pretty severe difficulty breathing. So high flow O2 will help with that. Cyanide, we have it out there. It's given off in fires when plastics and foams are burned. So it's something that we do encounter fairly regularly, but usually not something that we think about. Now this is going to interfere with the oxygen use at the mitochondrial level, so we're not going to really see the effects of this happening in the body, but they're going to be typically tired, weak, fatigued, maybe a little sick to their stomach, breathing fast, having difficulty breathing. You can have seizures from it, and a lot of times there is an odor of bitter almonds when you have cyanide in the air. It doesn't take a whole lot of this to make us sick, so make sure you are keeping a safe distance and letting the hazmat team, fire department do what they need to do with those. Pulmonary agents, these are things that are going to go into the lungs and are specifically designed to irritate the lungs. Phosgene is one that comes to mind. For these, there's going to be a lot of difficulty breathing. You may have some stridor, wheezing when you listen to their lungs, runny nose, watery eyes. We have a couple things to consider here. One is if the airway is swelling, that could become a true life-threatening immediate problem, and you might need ALS to intubate the patient so you can protect the airway. Otherwise, they're going to have difficulty breathing, so of course oxygen, high concentration of oxygen. If you're hearing crackles and pulmonary edema, you might even want to consider CPAP. Now, riot agents theoretically are not supposed to be deadly, but they're supposed to be very, very irritating. So they're going to have watery eyes, burns to the skin, runny nose. A lot of patients that I've taken care of that have been exposed to some sort of riot agent, like some sort of mace or pepper spray, typically will complain of shortness of breath and burning to the eyes. So you're going to be rinsing the eyes out to get the chemical out of the eyes and giving them oxygen if they're having difficulty breathing. Last one is just toxic gases in general, and there's a lot of different gases that are made in lots of industrial processes, and if somebody gets a hold of these and releases them, that can cause a problem. And really the treatment for these is going to be dependent on what the chemical is, but you can almost always assume that you're going to have to give these patients oxygen, and there may be some decontamination that goes with it. Now, biological agents, these are some sort of living organism or organism that can become alive. I know like bacteria can be put into spore form and then aerosolized, but some living organism, and these cause a wide variety of symptoms based on what it is. Now, oftentimes these will have to grow within a patient for a couple of days before the patient will begin to feel sick. So we may not see the initial exposure, but this is something that you're going to suddenly have a large number of patients that have similar signs and symptoms, and they all end up with the same sort of infection. Depending on what the infection is, pneumonia, same thing, pneumonia-like agents cause pneumonia-type diseases, so difficulty breathing, probably going to be giving these patients oxygen, might be thinking about CPAP, and they're going to need antibiotics. Now, biological toxins, these are chemicals that the biological agent gives off, so things like botulism, ricin are common ones. And these are not actually an organism to kill at this point, but there's like a bacteria that's producing this toxin. And depending on which one it is, you may have different signs and symptoms and have to do different treatments. So really you have to assess your patient, see what's going wrong. But many of these will cause some sort of difficulty breathing, paralysis, weakness, fevers, coughing, chills, that sort of stuff. And so basically giving them oxygen or transporting them. I realize that biological toxins themselves are not contagious, but whatever is making the toxins might be. And then encephalitis, so you're thinking brain here. So again, they have an infection, so they're going to typically feel sick and tired, feverish, maybe a headache with these, vomiting, maybe some neck pain or back pain with these, and you may not even recognize that they were exposed. You're just going to think they have the flu or something like that, take them to the hospital, and when they analyze and figure out exactly what is in them, then they'll know that they got exposed to a WMD. Now, one that we get exposed to every day is radiation. We get it from the sun, and in small doses like that, it's not bad. In fact, getting some sunlight every day is good for us. But if somebody were to create kind of a nuclear device or a nuclear explosion or some other radiation explosion, it could be very, very bad. It depends on how big it is and the strength of the radiation. And generally, the further you are from it, the safer you are. So distance, increasing the distance, and then trying to minimize your exposure to it, and trying to put any sort of shielding. So usually heavy things like lead, concrete, brick walls, earth even to a certain extent can help protect you against the radiation. Now, once somebody's been exposed, there's not a whole lot that we can do. For the most part, these will not need a significant amount of decontamination unless it was fallout. So there was an explosion, dust settled on them, and the dust itself is radioactive. Then these patients will have to be decontaminated like you would any other chemical before we should take them to the hospital. And for the most part, it's just supportive care. There's not like an antidote or a cure for radiation exposure. We just have to treat whatever symptoms they have. A lot of times they may have burns, so be ready to treat for burns. And then, of course, support the airway, breathing, and circulation like you do for all the other patients.